Okay, so the pressure knob is this one. This is the flow. Most important is that before you start, you turn the flow on. That allows the air to go in. Okay, and then the patient, and then you set the pressure. The pressure is like, think of it as not directly, I don't know if you know about pressure support, but basically what it is just boost of air going to the patient. Okay, when they inhale, that pressurized air goes into the patient. Okay, and when they reach the limit, it turns off by itself, automatically. So with this machine, it's very important that the patient seal their lips well around the mouthpiece. Why? Because when they're inhaling, the pressure fills out in the lungs, right? The negative pressure builds up, and it it shuts down the machine from delivering more. Okay, do you understand? Like inhalation. There's a certain amount that you can allow to get into your lungs. After a while, its negative pressure is going to build and force it back, and machine stops, shuts down. Okay? The reason I'm telling you it's important to seal it well, because if you have a patient who hasn't sealed their mouth well, the air is leaking out, he's breathing, but the air is not, instead of going into lungs, it comes out from the mouth. So do you think that machine is going to turn off? No, because it's not reaching its pressure. To see the pressures, there is the pressure manometer here that tells you how high is the pressure reaching. Let's say if I put the pressure 20, I would expect this needle right here to rise to level 20. That means it delivers the whole pressure. If you're seeing the patient, you place a 20 and the needle goes at 10 or 15, it doesn't reach the limit. That means, and you'll notice that most likely that it's not going to turn off. It's not going to cycle out because you're not getting to the limit of the pressure. Okay, the flow is continuously going because it's not reaching the pressure. It has to reach its set pressure that you set for it to turn off. Okay, another thing, since it's dealing with the patient, some of whom have, it's a spontaneous equipment that requires spontaneous breathing for the patients. So what they're going to have to do is sensitivity. Sensitivity is basically how much they little flow they need to trigger in, maybe a liter or half a liter or a couple of liters of flow for the cycle to kick in, the breaths to start. Okay, and sensitivity is on this side. It's also important to have this knob here. And the way you can also realize whether you're increasing or decreasing sensitivity, there is a term like that, increase sensitivity or decrease. When you're increasing sensitivity, you're doing what? When you make it easier for patient to initiate the breath. When you're decreasing the sensitivity, you're making it harder. Okay? So because the patient is initiating, if it's too sensitive, maybe very small inhalation, the breath starts going in. Okay? Maybe the patient doesn't want to breathe that doesn't want air to go that fast, that so often. But because the sensitivity is very high, it's very sensitive, the machine continuously, every single small trigger delivers breath. That's not good for therapy, for the patient and all. So that's why you have this knob to adjust it. Okay? And also if you come closer, you'll see the knob basically is very basic structure. One of them is a disc, just I think a metal disc. The other one is an aluminum magnet. Okay, and the way it works is basically this one is the magnet, the one that I'm holding, the hand, with the handle. Okay, and basically what you're doing, and the other one is the metal. What you're doing is you're bringing it closer or farther away, the magnet. Now, when the magnet and the metal are close together, like when I'm doing this, I'm bringing closer. What happens is when patient is inhaling, it has to push that plate, the metal plate, apart from the magnet. Okay? When it pushes away, that's when the breath goes in. Guys, listen here, please. That's when the breath is initiated. Okay? So when you have the magnet and the plate together closer to each other, do you think it's going to be easier for the patient to separate them or harder? Harder, right? Because the magnet and the plate are metal are next to each other. So, but when I'm putting the magnet farther away from the plate, and I'm letting the patient to breathe, do you think it's going to be easier for him to turn it up? Yes. So that's how the sensitivity works on this machine, basically. Okay? So those are the important things that you need to keep in mind when you're working the flow, pressure, sensitivity, when you're working with these patients. The flows, you also adjust. Some patients, you'll see that flow is also related to your inspiratory time, how fast the breath will be delivered. If your flow is very high, do you think it will take longer or shorter time for that breath to be delivered? Shorter, because the flow is high, fast, right? Goes in faster. The air is delivered faster. So, but when the flow is low, you'll notice that patient is breathing. Do you think that the breath will be delivered in a prolonged time or fast? Prolonged. And sometimes what you do is you see patient is breathing, but the air, it takes like a couple of seconds for the air to be delivered to the patient, and not necessarily that there is any leak, because the leak also can prolong the inhalation because it's leaking out. Sometimes you have everything sealed, but it takes just a little too long for the air to get in there to hit the limit. So then you're saying, oh, maybe because my flow is low. So then you adjust the flow, and the flow is straightforward with the knob here, with the arrow indicates if you increase it this way, it goes up. That means you increase the flow. That means the next breath, if the patient takes in, it should be shorter, faster. Okay, but if it's too fast, sometimes the patient is too fast. And you don't want it too fast because you want it a little slow to allow the lungs to, the alveoli enough time to expand well.
If
okay?
I can interject an example
yeah, sure.
while you're talking. Okay, think about it when you're driving. The accelerator is the same thing. You're either going faster or you're going slow, depending on how you are from the stoplight. Okay, so if you want to go fast, you're going to basically punch it. If you want to ease into it, you're going to step on the pedal and gradually build up speed. Same idea as the flow rate. It's how you're delivering the gas to the lungs.
Okay. So if you want it a little slower breaths, then you can decrease the flow. Allows more time for that air to go into the patient. And the patient will tell you, you know, if you can tell already if they feeling good with the flow and the rate and the pressure that you're getting. Sometimes if the patient is, maybe the pressures are also related to the volumes. Higher pressure, that means you're delivering, it will translate to larger volumes. Lower pressures will translate to lower volumes, right? That's how it is. So you'll have some patients who are just came out from surgery and they have an open heart, because this is very good machine for those patients who come out from surgery, who having a lot of pain, taking a deep breath, because those are the ones who tend to develop atelectasis over time. So incentive spirometers. Have you seen an incentive spirometer? Okay. Incentive spirometer or an Ippb machine are the ideal replacement, because those patients also cannot walk freely. Walking is also just, we don't realize it, but it's a very important, effective way to keep your lungs in shape. Okay? Because after surgery, those patients tend to sit in the bed, stay in the bed, immobile, lungs kind of in a, more minimized, chest cavity, okay, and they can't take a deep breath, they can't cough it up. Many of them want to bring the secretions out, but because of the pain, also, they don't. The secretions stay in the lungs. It tends to develop atelectasis, can lead to pneumonia if you don't clear it out. So this machine is also good to, when that air goes in and out, because it's a strong air, okay? Sometimes when the air goes, it kind of vibrates the secretions in the lungs. You'll see that sometimes after the treatment or during the treatment, patients actually start coughing. Okay? So basically it's expanding the lungs. You'll notice that the patient's oxygenation as the treatment goes on already, they might be setting 92, 93, then goes to 97, 98, 99 while they're already doing the treatment. Yes?
How would you figure the initial settings when you're starting treatment?
Just when I give the treatment already, by assessing the patient. Is my inhalation, do I feel like that patient is too slow or too long? I ask the patient, how is it now? I adjust things. Okay, sometimes the patient, that's what I was trying to also say, is because of their incision and the pain. The patient, you know, if you put the pressure high, too high, and he's taking a breath in, that's a lot of air going in. Chest is gonna hurt. Say, you know what, it's hurting. That means they cannot take too much expansion in the chest. So that means what you're gonna have to do, you're gonna adjust the pressures, you're gonna lower the pressure down, which will translate to lesser volumes. With the lesser volumes, that means less, their chest is gonna expand. Hopefully it's not gonna hurt as much. You communicate with the patient. Most of the time, patients on these machines, they're awake alert. Some elderly patients, okay, might not be conscious, okay, or weak enough to do with the mouthpiece. So you attach a mask, and you actually physically have to hold the mask against their face. And it has to be one discomfort about that is, again, the pressure of the mask on the face, because as I said, you don't want air to leak around, right, to leak out. Otherwise, the machine is not going to cycle off. Okay, so you have to press it hard enough, and unfortunately, yes, you do have to sometimes press hard enough for the mask to fit, to minimize as much as air leaking out as much as possible. Okay, so instead of leaking out, the air will be going into patients' lungs through their nose and mouth, because the mask covers both. It's like an ambu bag mask. Have you seen an ambu bag, guys? It's similar to that. It's a little with a cushion, okay? So it kind of fits on the face and it doesn't hurt too much. It's like, you know, soft. Okay? So basically this is Ippb. Ideally, of course, it's if you perform it. I don't know if we'll have it. I have to check with Mr. Ramirez if he's going to get circuits in. But the machines are here. Some things that you don't do it, you have sometimes clinical settings that you might not do any patient on Ippb. And you don't know how it works. You forgot. I told you today, you still have so many rotations. Nothing wrong. These machines are here all along. You always have labs here. You always have lab instructors here. I am available. If there is some equipment, something, or you want to go over again this thing, say, can we go over one more time the Ippb, because we haven't had a chance to do it at the clinical setting. And we'll be more than happy to go over. And hopefully by then we'll have a circuit available, so actually I can just hook it up, because there you've got to know some of the things that the hose is going here. And you know, it's very simple, but you still need to have an idea how it's attached. And there is a place actually with Ippb treatments, besides the fact that I told you, you expand the lungs, you also deliver medication. You can give the same albuterol and atrovent through the Ippb machine. There is a nebulizer port that it has at the bottom. Just mix it in there. As the air goes in, it nebulizes, and the patient is getting the medication as they inhale. Okay?
When you're setting like the pressure on these, do you set it according to like increments? If say it's not 20 and it's painful, do you bring it down to
Then
say,
I'll bring it,
15,
yes,
or
yes, bring it down.
just
Another
whether they're
important,
comfortable?
good question. Another important part of this machine is that there is a reservoir bag, not reservoir, yeah, I think it's called reservoir bag, not this one. There is another, have you guys seen it? No.
It's in the book.
In the book, it's a long bag like this. No? Let me see if there is one. Let me see. We might have it here somewhere.
Yeah.
Stop recording the prayers again.
Go away, Dan.
Can we get a copy of that?
Yeah, of course.
That's okay. I don't
Thank
see
you,
it.
Tara.
Let me read the text. It's just a plastic bag, long, elongated like this. Okay? And what you do with that bag is that you attach it also to the circuit. When the circuit is here, there is an exhalation port. Okay? When patient exhales out, that's the port that the air comes out to. Okay? What you do is you attach that bag to that exhalation port. Pretty much you cover it. So when patient exhales, and the bag has a number of breaths, it's already been pre-calculated, approximated. If basically what it is like 1, 2, 3, 5, 10 breaths, 20 breaths, 30 breaths, etc. And basically what it is, like next to 10 breaths, it gives you like 400 mLs.